Thanks very much. And if you have questions, I'd ask that you perhaps kind of make a mental note or write down which project your question is for, because some of the projects have some similarities. And we're fortunate to have many of the scholars on with us today. I'd like to defer to them at the end first, if they're able to answer your question based on their own experience. So I've already been introduced very well, so we'll skip that slide and move to disclosures. I tend to take this very literally, so I'm obviously an advisor for the NMF PCLP program here in Los Angeles, also employed by the Keck School of Medicine of USC, and I'm currently serving as immediate past president for the Physician Assistant Education Association. So those are the areas I need to disclose. In terms of learning objectives, the main goal is to highlight the work of these amazing scholars during their leadership program. And the scholars have come from a variety of institutions around the United States, and they include Wanda Everhart, Lauren Buford, Lisa Jackson, Allison Kang, Erica Manriquez, Carol Price, Ann Vo, and Jerry Lynn Wilson. This project's kind of focused on topics, including 4 that centered around either childhood or adult obesity and healthy living, and then 1 each in cervical cancer, teen pregnancy, reduced emergency department visits, and hypertension. I decided to put the first 4 projects together under obesity, as this epidemic is affecting children, adolescents, and adults, and there are many similarities among the 4 projects in terms of their lit review and some of the information and approaches that they took, and so I thought that would be easy for all of us to follow. Let's briefly discuss some facts that all the scholars for the obesity projects and healthy living projects illuminated in their projects about obesity. The World Health Organization has called obesity a global epidemic. Greater than 2/3 of adults are currently overweight or obese in the United States, with equating to over 78 million American adults suffering from this challenging disease. About 31% of children and adolescents in the United States are overweight or obese as well. So it's a significant problem even into our children's age groups. It's the second leading cause of preventable death. Obviously, it contributes to a variety of diseases, including heart disease, diabetes, etc. And so a very big challenge for us in the United States and obviously worldwide. And we'll look at some of the specific facts around obesity. See that 24% of our children or adolescents currently meet the physical activity recommendations that are up there that would like to see us all partake in up to 60 minutes or more physical activity per day. 18% of children and adolescents eat the recommended servings of fruit and vegetables per day. Over 40% of children and adolescents will drink at least 1 non-diet soda per day, and 8% or more are spending three or more hours of television daily or screen time daily. And obviously, when the American Academy of Pediatrics talks about screen time, they're not just talking about television anymore. They're talking about computer games, spending time on the internet, things of that nature, which essentially is pulling them away from all the activities that, at least in my childhood, we used to partake in, kick the can, baseball, things like that. So physical activity and screen time have kind of a direct correlation in terms of the increasing amount of screen time and the decreasing amount of physical activity. The project was completed by Miss Wanda Everhart, who is I believe, 4th-year medical student with the University of Illinois College of Medicine. She conducted her project with the Matthew Walker Comprehensive Health Center on childhood obesity. And the title of the project was Mommy Look at Me Eat, Exposing Myths and Exposing Truths, Infant Feeding Survey. Her goal was to decrease the frequency of obesogenic practices. And her focus was on 3rd trimester mothers and new mothers of infants from 0 to 6 months of age at the health center. And each scholar kind of had a project that they did with a subsequent evaluation or assessment of that project. And this used a variety of evaluation methods in their project. So I tried to capture each one on this slide, evaluation assessment, for your ease of use of following this. In this project, the assessment included a 10-question pre-survey that the mothers took prior to their appointment. Making statements in the document were true or false. And in the pre-survey, all the statements were false. So, for example, one of the questions or statements was, an empty plate equates to a happy plate. Another statement was, it is okay to put juice in a bottle. Or foods can begin as soon as my child is born. So there were some, basic nutrition statements that were placed into the pre-survey by Ms. Averhart that she had these patients take prior to the intervention. Completing the survey, the mothers were given a handout to read, and then they took a post-survey, and telephone interviews were done to try and increase the number of participants in terms of getting a larger sample size for the study. In conclusion, the things, there were a total of 9 surveys that were completed, with 1 partially completed. And of the respondents, 20% recognized that all of the statements on the pre-survey were false, and 60% knew that 8 out of 10 were false. The 2 questions that seemed to really, that were used to illustrate this concept of 50% error rate included the ones I mentioned previously on recognizing that the empty plate is a good thing and that juice in the bottle is a good practice. And so there was a lot of misconceptions about those 2 statements in the pre-survey. The 50% correct response in identifying the statements, and those statements included things kind of in the reverse. I should not pressure feed to make a big baby or to empty a plate. I recommended the bottle is to be weaned before 18 months. I should give my child cereal or juice in the bottle to double their birth weight by 5 months. So these were some of the examples of the post-survey questions after the intervention had been completed. It's shown in this project that these are prevalent in the patients at this health center, but we can also increase the knowledge and dispel the myths if we take time to further educate our patients on proper nutrition for our children. And obviously, I think Ms. Averhart's hope was, and I think there's some truth to this, that we as healthcare providers can decrease obesogenic practices, but it takes a little bit of extra effort on our time in terms of focusing on the education of our patients, understanding cultural nuances in the community that we're practicing, and then taking the extra time or developing projects like this that actually make an impact in decreasing those practices. Next project, project number 2, was completed by Ann Vo at the Northeast Community Clinic in Los Angeles, California, as a medical student at Howard University, and her project was titled Summer for Change, a Healthy Promotion Practice to Prevent Childhood Obesity and Its Long-Term Consequences. The teaching goal of Ann's project was to ensure that the pilot program was relevant, feasible, and sustainable in promoting health living for the pediatric patients at this clinic. This was on active learning that provided daily lessons on nutrition, physical activity, and cooking. Classes were scheduled to be 90 to 120 minutes in length. The participants included the parents, children from the ages of 5 to 14 years of age. And each of the children were given quizzes, or the participants, I should say, were given quizzes and evaluations as part of the project. The assessment or evaluation was to evaluate on the effectiveness, feasibility, and sustainability of the project, survey and quiz mechanisms. And the results showed, first of all, 53 parents and children participated in the educational events. 100% of the parents wanted children to attend these educational sessions. And 100% of the respondents liked the class. They enjoyed the experience. Interestingly, 3 out of 10 who attended admitted to eating the right amount of fruit every day, and 2 of 10 admitted to eating the right amount of vegetables. In terms of effectiveness, the average percent of the pre-quiz total, 50.5% on healthy living, versus the post-quiz after class, which went up to 76.9%. And so obviously, the educational intervention that Ms. Vo did made a significant increase in the knowledge of the participants. In terms of feasibility and sustainability, the cost of this project was about $100 for the materials for the class, and then the individual cooking sessions averaged about $20 per day. And so found the class ended up averaging about 60 to 90 minutes in length. So certainly in terms of her evaluation process, there's evidence to show that in this patient sample size, it was effective, it certainly seems feasible and sustainable given the low cost. I have included a sample calendar from those schedules showing the classes that were being taught in terms of some of the cooking and to that nature, just so you get a sense of how to approach that. So number 3. Number 3 was completed by Jerry Lynn Williamson at the Adelante Healthcare Community Health Clinic in Surprise, Arizona. And her project was titled Healthy by Design. And Ms. Williamson is a medical student at the Pacific Northwest College of Osteopathic Medicine. Provide educational and nutritional counseling about diet and exercise that would positively affect the health and well-being at both the individual level as well as perhaps the community level. And she essentially was teaching patients using by design worksheet. And the papers that were included in this project included patients who were overweight or and spoke English. And the worksheet highlighted the 5210 plan, and it also contained an action plan and physical activity advice, as well as nutritional goals. So the 5210 plan includes greater than or equal to 5 fruits and vegetables per day, less than or equal to 2 hours of screen time per day, greater or equal to 1 hour of physical activity per day, and 0 sugary drinks and more water each day as well. Were weighed at the beginning of the intervention, and the BMI was calculated, and then this was repeated 2 weeks later, and then again 2 weeks after that. And a session where they were weighed and the BMI was calculated, there was a process of accountability, encouragement, and motivation. Conclusion of the project, the average patient that had participated had a 1.9% change in their BMI in terms of positive change. Their BMI dropped about 1.9%. And patients felt better and had more energy following the project. So it seemed like they had a very good positive response to this short project, and probably, if it continued, could have a significant success in helping patients achieve a healthier lifestyle. Was completed by Allison Kang, who's a fourth-year medical student at St. Louis University School of Medicine. And it was also completed at Adelante Healthcare in Surprise, Arizona. And the title is Intervention for Obesity with Patient Education Handout, Promoting Healthy Eating and Exercise. The goal was to teach patients by utilizing a handout about healthy eating and exercise. And the handout included things around healthy shopping, especially on a tight budget, avoiding fatty toppings, things like that. Patients being served by Adelante Healthcare, and these were patients of Latino descent or Hispanic descent, included information on the nutritional labels as well. So how to effectively nutritional labels, and because it was on the family as well as the individual patient, because obviously the more we get the family educated and involved, the success we're going to have in making lifestyle change. Pediatricians at Adelante will be providing the handouts to their patients. So Ms. Kang created this handout that actually provides these opportunities for all these patients to get additional training and education from their clinicians. In addition, Ms. Kang, in part of this project, there are challenges with each of these projects. Each dollar had projects related to short amount of time they were there, related to some of the socioeconomic barriers in the communities that they were serving, et cetera. But in terms of Ms. Kang's project, one of her recommendations was to include an expansion of the project to include group sessions, so that there might be an opportunity for, I assume, feasibility, sustainability, and a larger footprint of impact in that community. And so that was project number 4. 5 was completed by Lauren Buford from the Morehouse School of Medicine. And this was done at Altamed in Los Angeles, California. And Buford's title was Receiving Non-Urgent Emergency Department Visits. And it was in some of the facts that she found that I'm going to relate to you. Definitely literature that talks about the excess use of emergency room visits contributing to the increased costs in our country related to health care. But I think sometimes there are people that believe that the uninsured are more likely to overutilize emergency departments, when several studies have shown that more frequent visits come from insured patients rather than the uninsured. And a study by Rothkopf et al., it was found that individuals that are insured by Medicaid and by community health centers are 1/3 less likely to use emergency departments than privately insured patients. So obviously, one of the things that was in this project was the positive contribution that community health centers are making in our communities and decreasing the overutilization of emergency departments from patients that utilize CHCs. Her goal was to provide educational counseling on appropriate use of after-hours care. And her focus was on the patients, specifically the mothers under the age of 25 in the Boyle Heights Ultimate site in East Los Angeles. Intervention further broke down into a focus on pediatric emergency rooms. Boyle Heights in Los Angeles has nearly 100,000 people, 6.5 square mile area. It's one of the most densely packed areas in Los Angeles County, and definitely has its challenges for our community. Innovation and assessment process, she a survey that was completed. A total of 24 mothers actually completed the pre-survey, which is on the mother's knowledge of after-hours care and a nurse advice line that are offered by Ultimed in lieu of attending an emergency department for a health problem after hours. And found that 6 out of 24 respondents were knowledgeable about hours options, and all 4 respondents used the nurse advice line. Now, were asked to sit in on an informational session that sought to educate them about the emergency and non-emergency care. Fortunately, none of the mothers were able to attend. So Ms. Buford found some of the challenges in that community in terms of trying to set up an intervention, to follow up with each participant by phone. She found that there were some challenges related to socioeconomics, things that maybe we as normal, I shouldn't say normal, as a clinician struggle to sometimes understand in our communities from our own socioeconomic changes. For instance, a bus schedule wasn't able to get somebody to the session in time, or perhaps the phones were disconnected when she was trying to reach out to the participants and encourage them to attend the session. So in light of those challenges she was facing, a change was made to the process, and they subsequently decided to conduct the survey, informational session, and a post-survey, all in one setting. And so they have 9 mothers complete the entire course by changing the process in their survey mechanism. And found was in the 9 mothers, they were all positive about the experience. Certainly found that learning occurred for the researcher around the socioeconomic barriers, and some patients in the period that the Ultimed to provide after-hour care options was actually being utilized by nearly 50% of the sample in the study. So Ultimed's having some success in providing these after-hours options and the nursing line after hours to try to mitigate some of the challenges of emergency department approach. So that was an interesting response for her in terms of the variety, in my opinion, of the to come into Boyle Heights and learn about a community, learn about the challenges of a culture in that community, which is largely Hispanic, and then expand some of those barriers. And as a physician, I'm sure she'll go into practice having a much better perspective about the impact of CHCs. Our project of a total of 8, completed by Jaleesa Jackson, who is a medical student at Johns Hopkins University, and she completed this project at the 17th Street Clinic in Santa Ana, California. And it was titled Cervical Cancer Awareness and Prevention Among Latina Women. So just some basic facts about cervical cancer. Genital human papillomavirus, or HPV, is the most common sexually transmitted infection and the most common cause of cervical cancer worldwide. In 2010, there were 12,200 new cases of cervical cancer in the United States and 4,210 deaths related to this disease. And NIH has funded a study which found that U.S. Hispanic women have higher rates of cervical cancer than Hispanic whites and African Americans. And the community where the 17th Street Clinic is placed has a large Hispanic population. Its goal was to host Cervical Cancer Awareness Day, with the display being placed outside of the clinic. And the hope for the display was to essentially reach patients who were coming into the clinic and leaving the clinic, but also to reach some of the women that were passing by. Jalisco utilized 2 promotoras to help Spanish-speaking patients in the community that were part of that clinic. This was on the Latino women in the 17th Street Clinic area and the people that passed by, with a 5-question survey that was developed and translated into Spanish. And questions included things like, can you get HPV? What can HPV cause? Is there a vaccine for HPV, etc.? The Scott utilized a raffle to incentivize participants who were given an opportunity to participate in a raffle if they completed the survey. Also, they were given another opportunity to participate in a raffle if they entered the clinic and scheduled a pap smear appointment. And one of the interesting findings in the experience there was that many of the women who were being were actually participating or talking with Jaleesa and her colleague were unfamiliar with the concept of a pap smear. So they actually grabbed a model from the clinic to be able to demonstrate how a pap smear was obtained. And that was to kind of help decrease the fear related to having a pap smear completed. Evaluation assessment, 5 surveys were completed. So they had a lot of participants who came by and showed interest, perhaps picked up some of the informational brochures that were on the table, but only 5 actually completed the survey. Of 5 that completed the survey, 100% knew that HPV can cause cancer. 2% of those 5 participants knew that it was sexually transmitted and knew about the vaccine. None of the 5 participants had previously received the vaccine, but 100% expressed an interest in obtaining one. The surveys was small. There was clarity in those individuals that HPV could cause cancer and the vaccine could help, so there was definitely some positive findings here. And I think one of the most positive things is Ultimed has decided to continue the Cervical Cancer Awareness Day and expand it into another clinic. And so obviously there's an impact that's been done by one of our scholars related to this suggestion of a Cervical Cancer Awareness Day that is now expanding into other clinics in the area. I'm just very excited to see that as well. This project was completed by Caroline Price, who's from the University of Alabama at Birmingham. Ms. Price completed her project at the Jackson Hines Comprehensive Health Center in Mississippi. Her project was titled Hypertension Education in a Community Health Center Setting. Related to her project, 31.3% of Americans currently have hypertension, and 1/4 of patients in the United States have prehypertension. And there were also some specifics to the state of Mississippi that were very interesting in her project. Mississippi's health statistics are generally worse than the average state in the United States. Roughly 2% of residents are considered to be in poor or fair health compared to 10% nationally. And it is almost double in Mississippi as compared to the national average. And physical inactivity is reported to be about 33% for the population as compared to 21%. So there are definitely some significant health challenges in this state. The project was to collect data and provide an educational intervention for patients on hypertension, tobacco abuse, diet, and exercise. And surveys were given to patients at the home shelter, South Jackson, Vicksburg clinics, Utica, and Hazelhurst clinics. And a total of 47 surveys were collected from all these different sites, The age categories distributed as follows. They categorize them as less than or equal to 29, there's a 30 to 39, 40 to 49, 50 to 59, and greater than or equal to 60. 48 shows a percentage of age range with high blood pressure. You could group the group age 50 to 59 had the highest percent. So the percent of age range that answered high blood pressure risk factor question correctly. The question was, which of the following makes a person at risk for getting high blood pressure? The potential answers included increased intake of salt, big weight, family history, smoking, drinking much alcohol, or all the above. And those that answered this correctly, the majority were in the 60 and older age group. Those the age range that knew a lot about sodium and sodas, and younger age range, the 29 and younger, seem to have the most knowledge of that. Next slide is the percent of age range that drink regular sodas, and our 30 to 39-year-olds are more frequently using regular soda. And percent of age range that want high blood pressure education, and again, the 30 to 39 age range group most interested of all the groups in getting more education about high blood pressure. It was a small study, but 47 people responding, which was great. Found that the people between ages of 30 and 39 had the least amount of education on blood pressure, but were most amenable to getting more education. And obviously, the educational interventions are imperative to help improve the overall well-being of the patients with high blood pressure and pre-hypertension. The last project was leaded by Ms. Erica Manriquez from the UCSF School of Medicine, and her project was titled Arizona Teen Pregnancy and the Role of Health Centers. And this completed at Adelante Healthcare in Avondale, Arizona. Teen pregnancy, the United States teen pregnancy rate is 10 times higher than Switzerland and the rest of any industrialized country in the world. And Arizona has one of the highest rates of teen pregnancy in the country. One Phoenix area high school boasting a 14% pregnancy rate. And nuances in Arizona, from Arizona, that maybe you've heard through the media. I just moved from Arizona, and so these are very familiar to me, but I found it interesting that our scholar kind of wrote about these challenges as well. She wrote that Arizona legislators have passed some several controversial bills. One bill wanting women, required women wanting their contraception to be covered by employers must submit proof of a medical condition, treatment for birth control like PCOS. Employers have to go ahead in the name of religious freedom to fire any woman upon discovering that used contraception to prevent pregnancy. In Arizona, has criminalized abortions after 20 weeks with very little exception for medical emergencies. Allows physicians to withhold information from a woman that could potentially lead her to choose abortion. On top of reproductive rights, immigration has come into the Arizona's political arena. SB 1070, law enforcement may detain a person and ask to see documentation if they find any reasonable suspicion that the person is an illegal immigrant. So there's some real significant challenges in the state of Arizona for healthcare providers related to the legislature that it also changes every year. And so there's always a continuous discussion politically in that state. Particular project, the goal was to complete an educational poster that would be posted in Adelante Healthcare's primary care clinics. And the focus was on girls and women and their parents at these clinics. Found that pregnancy was far more complicated than she had originally thought, with many deep cultural and social roots in her project. She found a lot about the history of Arizona and how Arizona's culture has contributed to the teen pregnancy rate in that state. She found that community health centers can play a significant role in educating potential parents about the challenges of teen pregnancy, and I think it was quite the learning experience from reading her paper as well. So are the 8 project scholars. In summary, they all focused on patient education in some way, platform. It ranged from small studies involving educational intervention to poster creation that I just mentioned, and covered some very important topics around obesity, teen pregnancy, hypertension, cervical cancer, and reducing non-emergent visits to emergency departments. Most importantly, from my perspective, after I read all these projects, is the opportunity for these scholars to learn about the community health center models and also about the role of primary care physicians and providers and what they can do to really impact a community. And in many of these samples that they illustrated, those impact being felt in those communities, and kudos to the clinicians who are working at these community health centers and providing such great care. At this point, I'm going to stop and actually open it up for questions for the scholars. I know we have several of our scholars online today. I'm going to answer any questions that I might be able to as well.
I'm going to jump in right now and just say this is Melinda again here at PCLP offices. I just wanted to mention that you all may need to unmute your phones or your microphones depending on how you're calling in today to the audio conference. So be sure to do that and just jump in with questions in your audio, or you can also type them over in the Q&A section over there, or in the chat section, whichever works for you best. So those are your options, and we welcome your participation. On unmuting everybody on here, so it may just take a minute to do that from the WebEx side of things, so just hang tight for a second. I'll see that we have a number of our scholars on this call who are actually were part of this presentation, so we certainly welcome your input on that as well, just experience and provide feedback. Somebody's unmuted, so just join in, and if you do have a question, I ask that you mute your phone, because we're getting some background noise. Hello?
Hi, my name is Lauren Buford. Can you hear me?
We can.
Okay. I'm a student at Morehouse School of Medicine. I have a question for the scholar who completed her project in Arizona on teen pregnancy.
Dr. Lowenry, are you still with us?
So okay. The scholar that did that, I believe, is on. That's Erica Manriquez.
Yeah, you guys
come in?
Yes.
Cool.
Lauren, do you want to go ahead with your question?
Yes. I know in your presentation you stated that you found some relation between cultural beliefs and the high pregnancy rate. I wanted to know if you could elaborate some, because I thought it was interesting.
Can you repeat that real quick?
In your presentation, you found a correlation between cultural beliefs and the high pregnancy rate.
Mm-hmm. Yeah. Okay, so basically a couple things that I found, okay, let me back up a little bit. So I think normally teen pregnancy is thought to be largely a problem of, like, there's not enough sex ed in high schools and not enough access to contraception. And that actually, through reading, I found out that's a factor, but it definitely is not the only problem. And so the key indicator that I found to be like predictive of high teen pregnancy rates in the area was poverty. And unfortunately, with that, like the presence of a minority population is is both a driving force both behind like early and high teen birth rates, and like how those are connected is sort of unclear still. But some of the things they were thinking about was particularly in the Latino population, there tends to be like a large focus on family and religion, and the use of contraception is not really part of like the discussion between like parent and child. From a religious standpoint of not using contraception, and from a standpoint of not engaging in premarital sex, so that doesn't tend to be like a part of, even when parents know that their kids, or it's kind of like a don't ask, don't tell policy. So the parents might think they're having sex, they don't tend to have those conversations. And then along with that, when these teenagers do, particularly girls, when they do have their babies, very culturally, it's pretty tough to not take care of your child. Like it's accepted for the teenage girl to drop out of school and take care of her child, than try to stay in school and finish her education or keep going with her education. From a cultural standpoint, like I found that was like people wanted to look down on the girls that did that, or it was just not acceptable in the families. So I mean, like you could see how that kind of fuels a cycle. Like girls drop out of school, they're not making much money. From a maturity standpoint, this is totally in our life too, but this is the trends that these studies found. From a maturity standpoint, their mother-child interactions tended to be like wanting, basically. They're still growing up themselves, they're still kids themselves, so being a parent was difficult. And then so it just kind of fueled this cycle where their kids grew up and tended to do like less well in school, and maybe at higher risk for neglect or abuse. They were less likely to have higher income levels, and they're more likely to be teen parents too. And like you're like fuel this cycle all in the context of like a culture that doesn't really want to talk about using contraception, or having teenage parents communication and maybe leave their kids in like with a family member or in daycare, if that's even like accessible or like actually feasible. So it was just like much more complicated than I ever thought would be simple.
Thanks for elaborating.
Yeah, you're welcome.
So this is Dr. Lohenry again. I'm curious if any of the scholars could also talk about the team-based approach in the community health centers that they participated in, since interprofessional education and practice is such a hot topic right now. Maybe perhaps you could talk about how that model is making an impact in the communities that you were serving in.
Hello. Can you hear me? This is Jaleesa Jackson.
Yeah, go ahead, Lisa.
Oh, hi. Yes. So I got exposed to the team-based approach when I was at the Alta Med site in Orange County this summer, and it seems to be extremely effective, mostly because in Orange County where I was, it was a very high Latino population, and sometimes there was that people in white coats and such. So there were a lot of promotoras there who were, who go out into the communities and take people, say, we can still talk to you about healthcare practices, but not in the clinic setting. And I felt that approach really works well, because not only do they come to the clinic and, they talk to the doctors and nurses, but then they also have the promotoras who relate to them on a social level. And I felt that especially when it comes to issues such as sexual health, and some of these women are very conservative, and it takes a lot for them to open up and talk about that stuff. And I was in a women's health clinic, and so it's important to have these discussions. And so it was great to have those promotoras and other Spanish-speaking people who could go in and relate to these women. And then we found out so much more when it came to why aren't you taking this medication? Oh, what's your sexual health history? And it seems to work really well. And I'm definitely thinking about implementing, even in Baltimore, where we also have a high Hispanic population here.
Interesting, Jaleesa, because oftentimes in the literature, Space practice talks about physicians, nurses, nurse practitioners, PAs, OTs, PTs, pharmacists. But you experienced with the promotores that made a big difference in your community. The concept of team should be even expanded beyond that, right?
Yes. So.
Any scholars care to contribute in terms of your experience on the team-based component?
Hi, Ray. I was also in Los Angeles this summer working with Ultimate, and I was very impressed by the team-based approach that Jaleesa talked about. They also do a lot of just mobilizing different resources within the one primary care visit. So after the physician has done their evaluation, they may bring in a case manager or patient educator or even a mobile oral health unit. So they make sure to maximize the patient's time and make sure they can mobilize as many things as possible, make a difference in the life of the patient. I thought that was a great way, especially when you're dealing with lots of undocumented, disadvantaged Latino population where they're presumably not interacting with the healthcare system very much, don't have the resources to, and may be intimidated to act with the care system. So in that one appointment, they were able to just accomplish so many goals and get so many things done.
Much.
Mm-hmm.
It came up if there are any other scholars that want to or input on the team-based component. The question for the scholars that are on the line, and it is, how do you plan to incorporate what you have learned from this experience in your future careers?
And then is directed at your peers here. From one of you, from Ruby Thomas, he's asking all of her fellow scholars to chime in about what you learned from this in your future career. So, it's going. We can.
This is Carol Rice. I did the hypertension education project. I know that for me, I plan to practice in Alabama, which isn't about the same situation as Mississippi. And I know that just working this summer, I handed out the surveys and then tried to provide patient education as a follow-up. And I just felt very comfortable by the end of the summer addressing those issues. And before this summer started, I know I was kind of uncomfortable about how to approach just kind of topic of obesity and about being over making the patient feel uncomfortable. And so my mentor had a lot of suggestions and just different people in the community that I talked to really talked a lot about ways to address the issue. Like there's a woman who had a master's in public health and had a community garden and gave lessons about nutrition as well as just all sorts of things. She had a free gym for the whole city of Jackson that she did in an old supermarket, and just little things like that will be things that really can address issues, which is just an amazing eye-opener for me.
Thank you for sharing that perspective.
Hi, this is Lauren Buford again. When I worked at Ultimate this summer, I never heard of a federally qualified healthcare center or a community care center having both the continuity of care and after-hours care. And so I think it's a great idea to incorporate after-hours care and make clinic available to patients in the evening after 4 or 5 o'clock when people get off of work. Because a lot of people work 9-to-5 jobs and they don't have access to care and are forced to go to the emergency room if they don't have insurance to cover them at another facility. And I also enjoyed the interaction between the patients and myself when we did the information sessions. And so I hope that I can incorporate some of that into my practice in the future.
Thank you. Hi.
Hi, this is Jaleesa again. I did the project on cervical cancer, and I plan on going into OBGYN in the future, and I found it very interesting just survey and also just talking to women at the clinic that it's to me that HPV vaccination wasn't really a topic that was discussed a lot in, your everyday clinic visit. And I consider it, just another form of preventive health. And so one way that this project affected me is that I plan on always asking women this question whenever I have a clinic visit, have you thought about this? Because it just seemed that a lot of them know about it before we told them about it, and that just lack of exposure led them to not the vaccination, even though for most women it was covered for them, and that will really change. Just I'm really more comfortable communicating with women about different practices, and I can say that's what I learned a lot from this project and that summer.
Lisa, all these, for me, are very inspiring. I'm excited about continuing to educate students because I see that our country needs leaders like all of you to make a big difference in our communities. And so thank you all for participating in this. Are there any other questions or any other scholars that want to contribute to this? I'm going to turn it back to Melinda, and thank you very much, everybody, for your questions.
I want to echo what Dr. Lenry just said, that as I was listening to some of the comments, actually, I've already been inspired from the PCLP staff perspective, and I happen to be a social worker as well, by actions that I've had with the scholars, as well as being able to review their professional projects, via my role here. It has definitely been eye-opening, and then to hear the scholars just now, say a couple of things that spoke to, the opening experience that they've had this summer is definitely, exactly what we, here at PCP want to hear. So that's really terrific. And Dr. Lee, thank you so much for this presentation together and examining and take time to review and process all of these wonderful presentations. I see that we have a question though from Dr. Cunningham, who is actually one of our esteemed members. Dr. Cunningham, feel free to chime on in.
Can you hear me? It looks like I'm on mute.
We can. You're not on mute. We can hear you.
Okay, great. Yeah. I'm very impressed by all of the student projects, and I would suggest and encourage each of you back at school now, I would encourage to share with your faculty members what your experience was, and for those of you that do not have an opportunity at your home campus to work with students from other disciplines, that you make that point to whoever your faculty members are or your advisors about how valuable that would be in the course of your regular studies back at home. Actually, are there any students on the call right now who actually do have that type of an opportunity at their home campus to work with students from other training programs? I would, but again, I would just encourage you to share that and help push the envelope. Faculty members at your home places need to hear this and understand how important it is, and there's no more persuasive way of doing that than hearing that directly from you, from a summer experience where you had the time working with students from other disciplines. Thanks.
Thank you.
I'd like to just add to that, if I may. I've had the opportunity here at the Keck School of Medicine at USC to participate with a student-run clinic that's started by med students, TOT, pharmacy, and PA, and has included social work and is trying to include dentistry. And it's amazing to watch the students in their learning and they're on each other's roles and how they've negotiated those experiences and educational backgrounds to provide a really comprehensive care for the patient in the clinic. So I would echo your comments and encourage the students to really think about encourage faculty and institution to support that. So thank you for bringing that up.
Okay, well, if there are no other comments or questions, then we will go ahead and end this second in our series of colloquia. Thank you, everyone, for joining us and participating. And, of course, thank you again, Dr. Lowenry, for your hard work on this. We really appreciate it so much. And we look forward to our next in this series that will be taking place tomorrow. But you will all get invitations for those, henceforth. So thanks again. Have a wonderful rest of your day, everybody.
Thanks.